here and there and not be redundant. So just a quick history. We went from these really large plugs to micro-mini grafts. We went to very, very tiny grafts or follicular grafts. And the question oftentimes is that the best option? And I think in certain circumstances, yes. In certain circumstances, when there's fine hairs, when there are curly hairs, you get, I think, more visual punch with some of the multi-unit grafts or the difollicular unit grafts or what's called mini grafts. We only use really now just difollicular units. I carry about 5 to 7 hairs. So I'm going to talk to you about how to build that hairline. I'm going to sort of run through the basic dynamics and tell you the differences of what I do, and then I'm going to focus on something that hasn't been explored as much in depth as is pattern design and thinking of how hair grows. Again, being a thinking surgeon rather than just a technician. So we like to use level 2 intravenous anesthesia, let them get sedated, put a ring block in of lidocaine after the hairline is designed and the occiput is shaved. We go ahead and then place a very dilute Kenalog epinephrine solution into the recipient bed and sort of preparation work, about 10 to 20 cc's at the beginning of the case before we do the donor harvest. We go back into the donor harvest and just emphasize what Shelley said is so important, is that donor tumescence is absolutely critical. Vance Elliott out of Canada came up with the idea of this metaphor of a ship on corals. When it's at a very, very high tide, the ship is way above the corals. When low tide, the ship rides over the corals. And what does that mean? The ship is the blade. And when the blade runs over the nerves and all that, and the blood supply, you get bad growth, bad wound healing. You get very, very bad results in the donor area and the recipient area, in addition to transecting hair that we heard about. So just something really important. I like it to be flat, blanched, and tumescent. We go back and do tumescence. And this tumescence is a little bit different because it's going to take me about an hour and a half to 2 hours to do the recipient sites. I put the recipient tumescence into the area that I'm going to be working on and then progressively move forward to the recipient tumescence. It's the same thing with the ship over corals, because as I'm doing this, if you're chopping through and hitting the bone on the skull, you're tearing through all the blood supply and you're creating bad growth, possible scalp necrosis, a lot of risk. So always think about tumescence in the world of hair being an incredibly important thing. And again, this is a sequential one. Let's talk now about understanding why a recipient site design is so important, because what it's going to do, it's going to dictate how that hair pattern is going to grow ultimately. And so what's important is unless I'm working in the crown, if I'm working in the front area, say like the hairline, the central scalp, or into the lateral hump, which is over here, I'm going to have the patient in a recumbent position because my hand naturally follows a very low angle. And that's the thing that I want you to understand. When you're working on hairlines and you make the hairs too straight up, you're going to have several problems. One, bad density, because there's no effect of shadowing of the hairs on the scalp. Two is going to look unnatural. Hair doesn't grow that way. Three is the fact that you're going to see insertion points for the grafts where they come in. And that's going to make a potentially natural result into an unnatural result. For all those reasons, consider having the patient supine, and really you almost can't go too low. You want to aim low with those angles. I'm going to talk to you about parallel techniques. You heard about parallel versus perpendicular. I don't believe one is better than the other. I think they're both very viable techniques. The reason I choose the sagittal or parallel technique is that I can get between hairs very well. I don't believe that the angulation is an issue because I aim so low with it. And I'm also able to create a very tight pattern and minimize in my hands possible future transection or past transection of their existing hairs. In other words, I can get around their existing hairs and grafts without as much of a fear of transecting other hairs. When I'm going perpendicular, I'm always worried about chopping through other hairs. Other doctors do a very good job of avoiding that. I find that I like the parallel technique. So if you forget everything I talk about, remember one thing. I just want you to go home with the understanding of how hair grows on the head. Because if you're just sticking sites in there and you don't know how hair grows, you're doing a disservice to your patient and really really getting suboptimal results. So what I like to do is talk about the hair in terms of regions. Think about the hairline, the central forelock, which is a part of the central mid scalp, an area a very, very important area to create visual density. The lateral hump, which is the area that when you see people do a comb over, that's because they're taking hair that should be going down and moving it over, and that's right at that lateral canthus junction out here. So that lateral hump is the area that has a different growth pattern. And then the vertex transition point is almost like a posterior hairline. It's the area where the back of the scalp goes from a horizontal plane to crown. And that's where Shelley was talking about stopping and ending that point. And we're going to talk about that through a different model in just a minute. So if you look, all the hairs here go forward. So there's a natural tendency when we're doing sites that we splay them open like this, but that creates a very poor visual density. So all the angles are forward and low. And when we get into the lateral hump or temple, which is over here, it's almost like a cascading effect. You see it go forward and then it's just dropping off and dropping off. And those angles are very, very, very low. I just talked about low angles. I'm talking about extremely hug the scalp low angles. One of the biggest errors I see in temple reconstruction is the too high an angle. The thing is sticking out like weeds. So you got to be very careful with that. And the thing just so I don't forget this is when we talk about hairline, we're so focused on the front hairline. The thing that's been really a major change in my practice over the last few years is thinking about the temple hairline. Because if you don't support the temple, you get this hairline that may jut too far forward and won't match it, the sides, and it looks like it can look like a toupee or a hair system. But even more important than that as well is the fact that you haven't framed the face. You know, I think as facial aesthetic surgeons, we want to not just do hair for the sake of hair. We want to know how that hair translates into a more attractive face, and that's a good frame. And that frame has several components. It's not just the front hairline. So the temple is an area that's really important to transplant, but it's also the most technically difficult place to transplant, and you got to be really careful if you're just starting out. With the crown, the angles go in a spiral effect or whirl, and these are different patterns that Ziering found that naturally exist. We're not going to go too much into those, but just to understand how crowns work. We talked a little bit about the recipient sites and the angles and directions. What this is when you're making the site and you're the surgeon creating the pattern, the angle is vis-a-vis the anterior scalp, how much lift it has. And again, really low angles, except for me in the crown or maybe in the sort of the back mid-scalp. But you can almost not go too low in all the other areas. And the direction means vis-a-vis this way, okay? And we're going to talk about how that plays into the design. I came up with this idea of a box model, which is the idea that if you understand where the hairline starts and stops and where the vertex starts and stops, it's where the horizontal plane becomes vertical, and the horizontal plane becomes vertical, and the horizontal plane becomes vertical. And that lateral hump is a vertical plane. The forehead you don't transplant onto, and the back is the crown. So if you start visualizing heads like a box, to me it's a great way for you to understand these regions in a very simplistic fashion that's very helpful. This is an illustration from a book Amina and I are working on that and they're not exactly perfect, so you see some X's there. But the goal is to say, you can see that the frontal region here, the angles go forward and low. The crown, there's a whirl. And as you get into the lateral hump, this area, that cascading effect. And in the temporal area, they sweep down and back with a very low angle. So go look at someone that has a naturally closely shorn head that doesn't have hair loss. We talked, Chris was asking a little bit about, talking about how I do mini grafts and all that. If I'm going to do mini grafts, or even if I don't, I like to build the first, most important density area first, which is the central forelock, anterior mid-scalp, and really be able to dedicate grafts in that area. Besides doing that first so I don't waste I have enough grafts to work on other areas, I also want to be able to interlock forward. Let me explain what that means. So I build back all my mini grafts, and then as I go forward, you can see I can tightly interlock going forward with the smaller grafts. I also prefer to use the bent needles for most of my site creations, and then going back and really getting a fence of follicular unit grafts all the way around, and then building the hairline. This is a crown recipient site to sort of show the seams of the suit, so to speak, and you can see that how there's a nice, whirl pattern going around and then blending up into the vertex transition point. And you can see that the upper limb is greater density than the lower limb because the upper limb cascades over. So it's just using grafts wisely. This is actually a combination of parallel and perpendicular sites. The parallel sites, this is the temple, the right temple for your orientation. These are all sagittal or parallel sites. These up here are parallel sites. And then as we get into the temple to get a really flat, when I want that angle super hugging, I have it literally flush to the skin. These are all coronal or perpendicular, I'm sorry to use so many words, perpendicular sites. These are all parallel sites. So these are, you can see they're going this direction. Female hairlines are very different. We talked about the shape already, and we're also, what I'm looking at is the cowlick of how the hairs turn. I found a lot of women, the recipient sites actually almost go backwards, and I'm actually matching that shape. I'm looking for, there's a great article that came out just this last month in Dermatologic Surgery about female hair patterns. If you haven't read it, read it, and it'll tell you how natural hair patterns exist in women. It's almost the exact opposite of men. There's a closed down angle, there's these little lateral mounds, and the hair angles can oftentimes go almost the opposite direction, in my opinion. Some pointers here. When you look at the hairline, you want to build it forward, because if you start with the hairline and go back, sometimes it's too straight. So I like to sort of just build it into the hairline, creating sort of this micro coastline effect. Don't make it too irregular. Sometimes the temptation is, let's make these big, juts, but a hairline doesn't necessarily look that way unless someone has a lot of recession. They could have something like that. The temptation is to make too much of these little eddies. I tend to make about 1 or 3 millimeter changes, and then I put these little sentinel hairs, which are bare hairs that stick out, to soften the hairline further. But you don't want to make it so loose and so wide that you can see the grafts, or you can see that it's too irregular. So actually this is a great example, because I think you can see some sentinel hairs that stick out. You can see it's not like this, they're just a little bit jaggedy. And actually, to teach you to see, I'm really glad, if you look, there's a little hole here. And this photo was taken before I went and touched it up, but I would go back and put one site there. So your eyes want to be looking for holes, looking for little patterns. And the more you do, and that's what we're going to do in St. Louis, you'll make a pattern. I'll look at it, I'll show you the defects, and they're too close, too wide, the angles are bad. And that way you get some visual feedback with this. So seeing. The more you do, the more you see, and you're looking for those holes in the design. You're looking for areas too tight. You're making sure that your hairline stays straight, and you're constantly going between mag eyes and a full view of the head. And always recheck your hairlines from all different angles when you're done. Just recheck and check and recheck. And a good thing is too is that if you're not, you can still, with all the techniques I've told you, have a little darkening effect on the skin from vascular compromise. So you always should have nitro paste in your office, in my opinion. And this is just to show you the larger view of these parallel sites with the natural hairline, some of the sentinel hairs in the finished product going forward. You can see here the temples going down. It's a little bit out of focus, but some of those perpendicular sites over here, the upper lateral humping going downward, and that just really everything's forward angled and low, not splaying in this central mid-scalp. These are just some results here, some Asian hair. You can see very hard to manage with Asian hair, but you want to be able to keep the angles low. A realistic example of a gentleman with a significant hair loss and a comb over. Female, this is a 2-session treatment where you're really closing down that frontal temporal angle and really accentuating the nice quality of the female cowlick. This is, you can see, almost this sort of pubic hair looking type of kinky hair due to bad graft dissection and placement. You're going to hear Amina talk about that in a moment. Too straight a line, poor growth. This is a 1-session correction of that. This is almost this like pitting effect due to the, again, bad assistance, and also the hairline's too straight, the angles are too up, the hairline is unnatural, it doesn't match the temporal pattern, and this is a one-session correction. This is, you can probably see again, the angles are way too, now you understand why the angles have to go down, because these are way too straight. The hair doesn't match the temporal pattern. It's just way too straight. The angles go straight up in the air. This is a 1-session correction. And this is just a 1-session to show you what you can do with a gentleman with a pretty advanced stage of hair loss. And we're using multifollicular units, difollicular units can create a lot of visual density in 1 session. So just the goal here is take hair transplantation seriously, and that's what I do, and that's really what I want to teach you today. Use your artistry, and really begin to understand how hair grows. Until you understand hair loss patterns and natural hair angles and natural hair directions, you're going to be creating results that may not be optimal. So, and this is the course to give you a plug, not plugs, but plug for the course coming up. It's really hands-on, in my opinion. It's the first of its kind where you're able to go out there, and I'm actually able to walk you through hairline design, walk you through, we have all the really great faculty to actually watch your site designs and critique it. Because you don't get feedback. You don't know if you're doing a good job out in the real world until you really get your hands dirty.